Okay. So who are the members of the healthcare team? And there's lots of different kinds of people that you may run into in your healthcare center. It could be a general or family practitioner. They're a physician. They could be a medical doctor, or they could be a doctor of osteopathy or DO. So either an MD or a DO. They're the only, basically an MD and a DO have the same amount of education. They go to the same number of years in their medical or DO school. They can go into all the different specialties and they can do the same work. The only difference with a DO is they have a system of practice with osteopathic manipulation. And there are some that think that they're a little bit more of holistic. They're looking more at sort of the whole child, the whole person, and how they fit within a family. So you also might have a pediatrician. And again, same thing. They could be an MD or a DO. Then you might have a nurse practitioner like myself. The two different specialties that would be taking care of children would be either a family practice nurse practitioner or a pediatric nurse practitioner. Nurse practitioners in general have had an undergrad nursing degree, which is a college degree, and then they have gone on for a master's degree in the area of their specialty. Now, I went on with a master's degree in a pediatric specialty. But when I got my nurse practitioner certification, it was back in the very beginning, and it was done in a continuing education program. So there may be a few of us around that did it that way, but then I did go on to get my master's degree. There are people who feel as well that nurse practitioners have a little bit more of a holistic perspective. We start from a nursing perspective. We want to know how that child is developing, how they're doing health-wise, and we try to share the information with families as far as nutrition, exercise, behavior, interactions, and any of the kinds of things that would come up during the growth and development of a child. A physician assistant is another person, or it's called a PA. If they have the little name cards, it will have PA after their name. And a physician assistant, and we're seeing lots of them in many different areas of medicine these days. They typically will have an undergrad degree. It's probably in some type of a science, but then they go on in a 2-year program to become a physician assistant. One of the years the first year is basically educational, where they learn about all the different parts of the body, and it's based on a medical model, though. It's based on the same kind of education, obviously very condensed, that a medical doctor would have. And then they go on for the second year. They do internships in multiple different spots. They can order medication. They can order tests. They can interpret them. They can work in surgery, and they may be working in a physician's office as well. The next person that you may come in contact with is a child life specialist. And typically, the child life specialist is a person that would be practicing in the hospital. So if anybody had but there are some healthcare centers where they may have a child life specialist as well. This person's background is basically in more of the child development. And then they have another extension of their internship is 480 hours of internship where they would be working within, like, helping children who are going to be having surgery, children that are going to be going through testing, children that may be new diagnosed of an illness, so that they help through a play-based program, helping the child learn, feel more comfortable, They particularly understand the emotional and anxieties that are brought up when you have to go to the hospital. So they help the children and the families be able to work with or to be able to be ready to do the testing. The next person that you might see in your healthcare team is a nutritionist or dietitian. And that would be for a child that might be diagnosed with something like diabetes, or a child that has some growth problems, some of those kinds of things. And that might be one of the referrals your primary care provider would be sending you to. A social worker is another person on the team. They are master's prepared. They would help. They can help in things like if children are going to be referred out for services, they may help the physician to be able to help to work with the family and be able to get them into services that would be appropriate. As well, they could help with things like housing, or helping get insurance, or helping get, I've lost my train of thought. And helping get food, if there was a need for food, to help through all those social kinds of issues. Then the medical assistant is somebody who is trained specifically to work with the doctor in the office and to assist with care in the office. They may be, what we are now seeing is certified nurse assistants, so it's a CNA, and their education is probably, I'm not even exactly sure, because when I went in to try to figure out how long it was, definitely less than a year, and probably more like a 6 month. And then the receptionist would be the person that answers the phone and tries to send you to the different people that you would need in order to make appointments or to answer questions. So there's a lot of people involved in a healthcare program.